Hey y'all, I'm back. This is a second renal quiz, and this one is customized. I made it hard and only is focusing on the topics that were on the outline. So let's go. A pediatric patient presents with elevated blood pressure. According to growth and development principles, which physiological assessment is the priority? A. Monitoring for peripheral vascular resistance and atheros, whatever. Evaluating cardiac output and heart valve integrity. Screening for neurological causes of autonomic dysreflexia. Assessing renal function and glomerular filtration. Okay, so since I know that that high blood pressure in kids is most likely due to renal function, I will go with D. Hypertension in children is more closely linked to renal dysfunction than to cardiac disease. What is the expected minimum urine output for an infant weighing 8 kilograms over a 12-hour period? Um, 8 kilograms. Mm, I don't know. Like, I'm just gonna pick 96. Seems a little low for a 16-pound baby. Um, I'm gonna go 192. Okay. Um, Infant urine output should be calculated at approximately 2 milliliters per kilogram per hour, resulting in 192. Okay. When analyzing a laboratory report for suspected urinary tract infection, which finding in a catheterized specimen is considered diagnostic for bacteriuria? Um, I only know this because I answered it wrong on the last quiz, and it is greater than 10,000. A newborn is diagnosed with bladder extrophy, whatever. Which immediate nursing action is essential to prevent tissue injury prior to surgical repair? Covering the bladder with plastic wrap and keeping it moist, securing a tight-fitting diaper to minimize exposure to air, cleaning the bladder surface with 10% providone iodine solution, applying a dry sterile gauze dressing over the exposed bladder. Again, from the last quiz, I know that it is this. Following surgical closure of bladder exstrophy, why is it critical for the infant to remain in traction with legs raised at 90 degrees for 4 to 6 weeks? Again, this was on the last one, so we'll just go ahead and do that. A nurse is educating parents of a newborn with hypospadias. Which instruction regarding early health care should be emphasized? A. Avoid circumcision to preserve tissue for future surgical reconstruction. B. Ensure the infant receives testosterone injections immediately at birth. C. Prepare for surgical mediotomy within the first 48 hours of life. D. Schedule a circumcision as soon as the infant is stable. This one is to prevent circumcision. How does chronic constipation contribute to the development of recurrent urinary tract infections in children? A. It causes a shift in vaginal pH, encouraging bacterial migration. B. Large stool masses put pressure on the bladder, leading to urinary stasis. C. It leads to overgrowth of E. coli within the small intestine. D. Straining during defecation forces bacteria into the urethral opening. I believe it's B. Yes. A distended large intestine can prevent the bladder from emptying normally, creating an environment for bacterial growth. Which assessment finding would require the nurse to postpone a scheduled voiding cystourethrogram? The child has not voided for over 6 hours. B. The child currently has symptoms of an active UTI. C. The child is crying and fearful of the procedure. D. The child has a history of iodine allergy. A voiding cystourethrogram. I don't know if they use contrast for that, but I'm gonna go with that because, um, I don't know. Nothing else sounds right. Oh, okay. The child currently has symptoms of an active UTI. Injecting radiopaque dye into the bladder during an infection can spread bacteria to the kidneys and cause pyelonephritis. Okay. Following a laparoscopic ureter reimplantation for vesicoureteral reflux, what is the priority assessment for the nurse regarding the 2 ureteral stents? Ensuring the stents are clamped for 30 minutes every 4 hours, confirming the stents are positioned above the level of the bladder, checking for presence of large clots in the drainage bag, verifying both stents are draining equal amounts of urine. It's D. Assessing equal drainage confirms that both kidneys are functioning and that no obstruction is present on either side. Why must the nurse caution against the standard practice of limiting fluids before bedtime? A. Fluids are necessary to maintain a higher bladder capacity. B. Restriction of fluids interferes with the efficacy of desmopressin. C. Dehydration can trigger a sickle cell crisis through increased cell sickling. D. Fluid restriction can lead to increased serum potassium levels. Mm, I don't know. Um, hmm. I don't know the context. Like, this seems. I don't know. I um. I don't know. Maintaining hydration is vital in sickle cell anemia to prevent the vaso-occlusive complications associated with sickling. I don't know why we're talking about sickle cell in the renal quiz. Okay. Which clinical manifestation is considered the hallmark initial symptom of acute post-streptococcal glomerular nephritis? Um, Hypotension and poor peripheral skin turgor. B. Profuse watery diarrhea with abdominal cramping. C. Sudden onset of tea-colored or smoky-colored urine. D. Generalized pruritus and maculopapular rash. This, I believe, is the tea-colored or smoky-colored urine. The presence of hematuria from glomerular inflammation gives the urine a distinct reddish-brown or tea-colored appearance. In nephrotic syndrome, why does the patient develop hyperlipidemia? A. The liver increases lipoprotein production to compensate for low serum protein levels. B. Corticosteroid therapy directly increases the synthesis of cholesterol in the blood. C. A high-fat diet is typically prescribed to provide calories during protein loss. D. The kidneys lose their ability to filter lipids, causing them to accumulate in the blood. Um, well, it's definitely not C. Um, so, nephrotic syndrome is the one where there's protein loss, the albumin escapes or whatever. So, I would say it's probably A. Yeah, I'm gonna go with A. Okay. Hyperlipidemia is a compensatory response by the liver as it attempts to address the hypoalbuminemia caused by, oh my god, all these big words. Which positioning is most effective for a child with nephrotic syndrome to minimize periorbital edema and respiratory distress? A. Side lying with the legs elevated above the heart. B. Semi-Fowler position with the head elevated. C. Supine with the head of the bed flat. D. Prone with a pillow under the abdomen. Um, it's definitely B. Elevating the head of the bed uses gravity to reduce facial edema and eases breathing by reducing abdominal pressure on the diaphragm. A nurse is monitoring a child after a renal biopsy. What is the priority nursing intervention during the first 24 hours post-procedure? A. Obtaining and comparing serial urine samples for the presence of blood. B. Restricting all fluid intake until the first void. C. Removing the pressure dressing every hour to inspect the biopsy site. D. Ensuring the child remains in a high Fowler position for comfort. Priority. Um, I would assume it's C. I don't know. It's just a guess. Um, I don't. I don't know if they restrict fluid at all, and I don't know. Yeah, I don't know. I'm just guessing C. I guess it could be A too. I don't know. C. I'm just gonna go. Oh, should have gone with A. Monitoring serial samples allows the nurse to detect whether hematuria is increasing or decreasing as the site heals. Okay. Which medication is the primary choice for treating primary nocturnal enuresis by promoting water reabsorption in the renal tubules? A. Furosemide. B. Oxybutynin. C. Desmopressin. D. Nitrofurantoin. Mm, well, it's definitely not A. I don't know what D is. I'm not gonna lie, I forgot what desmopressin is. And I don't know what oxybutynin is either. So this is a big guess. I don't know what the DDAVP after the desmopressin means either. I'm gonna, I don't know. I'm just gonna go with C. DDAVP is a synthetic antidiuretic hormone that decreases urine production at night by increasing water resorption. Resorption. Okay. During peritoneal dialysis, what occurs during the dwell time phase? Oh, these are hard. The dialysate is drained from the peritoneal catheter into a collection bag. B. The patient is encouraged to walk to improve the drainage of excess fluid. Fluid and electrolytes move by osmosis and diffusion across the peritoneum. D. Dialysis solution is rapidly infused into the abdominal cavity by gravity. Dwell time. Um, I don't know the answer to this. Well, dwell means like, I don't know. I see it as like sitting there for a while. So I think that A doesn't align with that. B, the patient is encouraged to walk to, I don't know. B doesn't feel right either. Fluid and electrolytes move by osmosis and diffusion across the peritoneum. I mean, maybe. Dialysis solution is rapidly infused into the abdominal cavity by gravity. I'm gonna go with C, because C seems like the only one where it'd be like hanging out for some time. Okay. The dwell time is when the solution remains in the cavity to allow for the exchange of waste and fluids. Excellent. Prune belly syndrome is primarily characterized by which triad of symptoms in male infants? Bladder atrophy, epispadias, and pubic bone diastasis, whatever. B. Undescended testes, abdominal muscle deficiency, and urinary tract dilation. C. Hypertension, proteinuria, and periorbital edema. D. Enuresis, constipation, and vesicouretal reflux. Mm. Prune belly. Prune belly. Um, so I don't think it's A because, man, that would be a lot of things. Undescended testes, abdominal muscle deficiency, and urinary tract dilation. Maybe that one. Like when I think of a prune, it's like wrinkly. So I'm not thinking of like edema or I don't know. D is bedwetting, constipation, and that ureteral reflux is like when it shifts backwards instead of like coming out, I think. So, mm, mm, I'm gonna go with B. Oh, wow, okay. These three findings define the urologic and structural hallmarks of the syndrome. Okay, well, that was a very lucky guess. Which extra-renal findings are associated with Alport syndrome, a form of chronic glomerulonephritis? Okay, hearing loss and ocular changes. B. Cerebral aneurysms and liver cysts. C. Potter facies and hypoplastic lungs. D. Undescended testes and cardiac defects. So chronic glomerulonephritis. So that gives you like the tea-colored urine. Mm, I don't know what a hypoplastic lung is. Hearing loss and ocular changes. Um, I don't know. I don't think it's D. I don't know what either one of the things is for C. Cerebral aneurysm and liver cysts. Hmm. I mean, I know if you get like a kidney infection, then you can get pneumonia. So like I know things can go to your lungs. Mm, I'm just gonna choose C. Sorry I'm taking so long. Okay. Alport syndrome is a genetic disorder that affects the kidneys, ears, and eyes. That is so random. Okay. Alport syndrome. Kidneys, ears, and eyes. Got it. Why is Potter syndrome associated with bilateral kidney um, agenesis in newborns? The lack of kidneys causes a toxic buildup that stunts lung growth. Kidneys and lungs develop from the same embryologic germ layer at the same time. The absence of fetal urine leads to oligohydramnios, causing lung compression. The high blood pressure in utero causes the lung tissues to fibrose. I don't know what Potter syndrome is, and I don't know what. Well, I guess bilateral kidney agenesis would be like your kidneys didn't develop, maybe? Or so I'm probably gonna say it's either A or B. I think it's A, maybe. Because I don't think kidneys and lung develop from the same germ layer at the same time, because the lungs are the last thing to develop. But I don't know when the kidneys develop. I'm gonna go with A. Oh no. The absence of fetal urine leads to whatever that word is, causing lung compression. Without fetal urine, there is insufficient amniotic fluid, leading to compression of the fetus and hypoplastic lungs. Okay. What is the primary cause of dialysis disequilibrium syndrome during hemodialysis? A. An allergic reaction to the fibers used in the dialysis machine coil. B. Urea being removed from the blood faster than it can shift from the brain. C. Rapid removal of sodium leading to severe muscle cramping. D. Septicemia introduced via the venipuncture site during the procedure. I think it's B because I feel like your equilibrium is in your brain. So, B. The osmotic gradient created by higher urea levels in the brain causes fluid to shift to the brain, resulting in cerebral edema. Which dietary intervention is typically required for a child with acute glomerulonephritis who has hyperkalemia? A. Providing a diet high in bananas and milk to support renal recovery. B. Administering a potassium-removing resin like sodium polystyrene sulfonate. C. Encouraging a high-protein diet to replace losses of the urine. D. Restricting all sodium and fluid intake to 500 milliliters a day. Probably B. When kidneys cannot clear potassium, medication is needed to facilitate its excretion through the GI tract. A child is receiving long-term prednisone therapy for nephrotic syndrome. Which clinical finding should the nurse identify as a common side effect of this treatment? A. Cushingoid appearance, including moon face and increased body hair. B. Marked weight loss and skeletal muscle wasting. C. Hyperactivity and a significantly increased growth spurt. D. Hypotension and increased insulin sensitivity. Cushing's is associated with steroids. So we're going to go with that one. What does the term CORD refer to in assessment of a child with hypospadias? The absence of a typical bladder filling cycle on ultrasound, a fibrous band that causes the penis to curve downward, the failure of one or both testes to descend into the scrotum, the displacement of the urethral opening to the dorsal side of the penis. It's B. It's a structural abnormality often associated with hypospadias that results in a downward curvature. Which condition is characterized by a urethral opening on the dorsal surface of the penis and is often associated with complete incontinence? A. Hypospadias. B. Patent urachus. I don't know what that is. C. Epispadias. D. Vesicoureteral reflux. So it's definitely A or C. Hypospadias is the underneath and epispadias is on top. But my problem is I don't know what the dorsal surface is. What does dorsal mean? I don't know what dorsal means. I forgot. I don't know if the urethral opening on the top or the underneath would cause complete incontinence. Or maybe it's B, because I don't know what that is either. I just don't know where the dorsal surface is. I'm just going to choose that. Okay. Epispadias is a more severe defect on the dorsal. Dorsal means upper wall of the urethra. Okay. What is the clinical significance of any bacterial growth in a suprapubic aspirate urine sample from an infant? A. A bacterial growth in a suprapubic aspirate is significant for infection. B. It is considered a normal finding in infants under 6 months. C. It requires a follow-up catheterized sample to confirm the results. D. It is only significant if the count exceeds 50,000 CFU. So I don't think it's D. But I don't know. I wouldn't say it's normal for infants to have bacteria. So I don't think it's B either. I think it's either A or C. I'm just going to go with A. Because the aspiration is a sterile procedure directly from the bladder, any growth is considered diagnostic of UTI. Okay. So, any bacteria from suprapubic urine sample is problematic. But if it's from like a straight calf, then it's some bacteria can be okay. Alright, got it. Vesicoureteral reflux is graded from 1 to 5. Which grade represents the most serious form of the condition? Oh, well, I don't know. It's either 1 or 5. I don't know if it goes down or if it goes up. I'm going to go with 5, but I'm probably going to be wrong, and it's going to be 1. Okay. Grade 5 is the most serious and involves significant retrograde flow and potential kidney pressure. All right. Not so bad. Okay. Well, I hope that helped. Bye.